Good afternoon, everyone. Thank you for joining us for our Practically Speaking webinar series. I'm Avital Habusha. I'm the Vice President for Programs here at the Foundation. And today we'll be focused on a really critical topic of caring for our frontline healthcare workers during COVID-19. As all of you know who are joining us today, since March, our frontline and essential workers, those in social services and healthcare, deliveries, public transit, and across many other sectors have really been on the front lines, working tirelessly to keep New Yorkers safe and healthy. And in New York City alone, these workers make up more than 25% of the workforce, representing 1 million workers. And as we now are primed to enter what we know is going to be a difficult fall and winter in the face of the pandemic surge, it's now more than critical than ever that we have the tools to care for these colleagues. And as we all know, these workers have been caring for New York's most vulnerable communities, while they're often managing their own uncertainty, illness, and grief in their own personal and professional lives. And physical distancing has also led in many cases to more social isolation and physical isolation. And it's interrupted a lot of their personal bonds with their patients and with their colleagues, which is so central to their work. And so instilling a culture of self-care, both at the individual and organizational level, is really a critical challenge that we continue to need to address, because we also know that frontline and healthcare workers often don't have time left to care for themselves after caring for others. But our guests today have implemented some really unique and helpful approaches that can help improve and care for these workers. And so I'm going to introduce them, and then we'll get started in sharing some new ideas. So Lisa first is the Assistant Vice President for the Center for Policy Advocacy and Education at Vibrant Emotional Health. She'll tell us a bit more about Vibrant, but they promote individual and community resilience by providing on-the-ground health and emotional support in the aftermath of disasters and emergencies. And Tahina Day O'Connor is the Executive Director of the Physician Affiliate Group of New York, or PAGNY, Health Research Foundation. And PAGNY is one of the largest physician groups in the nation, and its members work at New York City's public hospitals and in correctional health facilities. And they've partnered very closely with Vibrant over these last several months. So Lisa and Tahina are going to share some tools and approaches and lessons learned today, but we also know that many of you on the call have been also implementing creative solutions, dedicating resources to support frameworks in your own organizations to promote emotional well-being of your teams. And so we look forward to the opportunity to continue this conversation and to have a chance to share some ideas in response to the tools that we're able to share with you today. So before I turn it over to them, I'll just do a few quick housekeeping issues. So the webinar, so all you know, is being recorded. We'll be sending it out as part of an event recap after with any materials and the slides that we're going to be sharing today. And also the video and audio is disabled for participants, but any questions or comments you have, you can use the chat feature. And we will be finding time at the end of the discussion to answer questions and to have a bit of a discussion. And our panelists will also be sharing their contact information so that we can have discussions after the close of the webinar. So without further ado, I will turn it over to Lisa, who's going to get us started, and then we'll move on to Tahina. Thanks so much.
Thank you so much, Avital, and thanks to everyone who is here today. So pleased to be here. I am going to share a few slides with you. And really the focus of what I'm going to be talking about over the next few minutes is what I'm calling the value of self-care. But before I even get into depth of the material, I just want to note that there is so much emphasis on what we call self-care, which really puts the onus on the individual to solve all of their stress-related needs. And it really isn't just about what we as individuals do. We are individuals embedded in organizations, in institutions, in communities, and it's really not about each individual person figuring it out on their own. To the extent that our organizations and institutions and communities can take a more collective approach and a planned approach that can be implemented across the board, that tends to boost any individual effort for self-care. So I am going to dive into individual self-care today, but know that that's within a larger context, and that will be something that Tahina also talks about. So with some generous funding from the New York State Health Foundation, what Vibrant has been able to do is provide training to frontline workers. And what you'll see here on this slide is a series that we are currently offering and will be continuing to offer throughout the current fiscal year. And why are we doing this? Training isn't everything. Why is training important? Training is important because in and of itself, it provides an environment for people to share their own strategies, their own techniques. It's an opportunity to learn from each other as well as from experts. And a lot of the topics that we're focusing on really do have resonance in the current moment. So things like vicarious trauma that we know frontline workers are experiencing. There are many managers and supervisors who want to know, how can I use my relationship with my staff to support them better? How can I, as an individual, take care of my own well-being? And how can I, as part of an organization, help my organization foster a culture of well-being for all staff? And you'll note that psychological first aid is here. That is a training that is really skills-based. How do we help each other? How do we help the people we serve when there's been a disaster experience? And frankly, we are all still experiencing a disaster. And the reason Vibrant does this, some of you may know about Vibrant, some of you may not. We do a lot of training and technical assistance in these areas on mental health and wellness topics. Some of you may know us because we run NYC Well here in the city, which is the mental health hotline, and you'll hear about that in a moment. We also run the National Suicide Prevention Lifeline. So we do have some national programs as well. So if the name Vibrant is ringing a bell, that's probably why. If it's not ringing a bell, you may have heard of some of those other programs. So one resource that I want folks to know about is our Staying in Balance Toolkit. And this is something that a link to this is going to be put in the chat box. You will also receive this link in the after materials that you'll get along with these slides. This is a toolkit that Vibrant created with some different grant funding before the COVID era. And it's a great resource for organizations and individuals to focus on fostering well-being and wellness in the workplace. It is specifically geared toward the nonprofit sector, which we know has stress under ordinary circumstances, let alone what is currently happening. But the resources and the tools and tips that are in there are quite relevant to today. And one of the things that I want to highlight as a big feature of the toolkit, which you will see, is a piece that is in there called the self-care assessment. That is an instrument. It's a very easy to do questionnaire, and you'll be receiving the questionnaire in the materials that you get. And it's a wonderful way of quickly assessing what are the self-care activities that you're currently engaged in, and what are the self-care activities that you might like to do more of, more frequently. And there's an assessment piece where you can indicate that for yourself. And there's also an opportunity within the document to create your own self-care action plan. So it's not just assessing, it's also figuring out, oh, well, if I want to beef up my self-care, if I want to do more, how do I do that? And what am I going to do? And it's a great tool to have. One of the things I love about the tool is not only its ease of use, but it can be done over and over again. You know, self-care is an ongoing activity. It ebbs and it flows. It's a great way to check in, to do that assessment once a week, once a month, just to see how am I doing on my own self-care. And that's a great tip to do. I mean, doing self-care is one thing, knowing that we need to check in and see how we're doing with it is another. So both things are together. So take a look at that when you have an opportunity. I mentioned a moment ago NYC Well, and I want to talk about it as a resource for all of you and for people that you work with and your staff. This is a hotline that pre-existed COVID, but certainly is in heavy rotation now. Vibrant operates NYC Well on behalf of the city of New York, and it's a great service. It's free, it's confidential, it's 24 hours a day, 7 days a week, and people who want to talk to a counselor can text and communicate that way. They can call NYC Well, or you can chat on your computer. And so there are 3 great ways, depending on your circumstance and your preference, to connect with a counselor any time of the day or night. And so I want folks to know about this resource. You may never use it for yourself, but it's one that is valuable and worth passing on to people that you know and to people that you're serving. Now, a new resource that Vibrant and the Coalition for Behavioral Health have partnered on with some grant funding is what we're calling the New York City Frontline and Essential Workers Hotline. This too is a free and confidential service, and it's really geared toward exactly the folks that we're talking about here, those people who really are on the front lines of providing services of any kind, whether that's healthcare, social service support, other kinds of direct support. You know, there's a lot of stress in that. And we wanted to create a resource just for that population of staff in the city. So this is a line that operates Monday through Friday from 10 a.m. to 10 p.m. And the number is listed there, and you don't need to write that down because, again, you will be receiving all of these slides and you will have that at your fingertips. But I do encourage folks to use this. If you feel like, you know what, I just need to talk to somebody about what's going on and blow off some steam, this is the number to call. And I certainly encourage folks to do that. I do have a couple of other slides that I'm not going to go over, but I want you to see. This is a list of basic tips, wellness tips. You probably do many of these. You've probably heard of many of these. Maybe you've thought, gosh, I really want to do this and I haven't yet. This could be part of your self-care assessment. So you will get this list of tips. And we also have a resource list here, different websites that you can use on your own time and share with others when you want to relax, when you want to take 5 minutes to breathe and carve out some of that wellness space for yourself. And it doesn't have to take long, and it's great to have online resources. So I wanted to make sure everybody got that, and you will get that in the slides as well. And with that, I want to turn it over to Tuhina, who has done so much work with PAGNY to boost wellness. And I wanted to open up the floor to her.
Oh. Your screen's paused. Oh no. Sorry, guys. My screen is paused for some reason.
Let's see. I can pull up your slides.
I got it.
Oh, you got it?
Oh no.
Technical difficulties, always the, why don't, you know what, Tina, I'll share your slides so we can.
Okay, that sounds good. I'm
Great.
sorry.
That's okay. Here we go. And you can tell me when to.
Go ahead and start the.
There we
share.
go. Okay.
All right, great. I'm sorry about that, guys. Thank you, Lisa, and thank you, Avital. I'm so happy to be here, and it's really great that you're all thinking about this, and we hope it can be helpful. I'm Tuhina De O'Connor from the PAGNY Health and Research Foundation, as Avital said, and she also mentioned that we're one of the biggest physician groups in the country. We have 4,000 clinicians, 2,000 that are doctors, and 2,000 that are other allied health professionals. And we staff 7 of the 11 New York City public hospitals, the H&H hospitals. So all of their clinicians are actually our clinicians. So in addition to a lot of family health clinics and the correctional health system. So as you can imagine, chaos ensued when COVID hit our city, and most of our clinicians were working around the clock, double shifts, and using PPE. They were scared for their patients that lined the hallways on gurneys. They couldn't even get them anywhere, scared for themselves, and scared about what they were bringing to their families when they went home. One told me he had never been around so much death. A code gold announcement would come over the loudspeaker, signaling the death of a COVID patient just about every 20 minutes. So all the clinicians knew, oh, there's another one, there's another one. And everybody would take a pause, take a breath, and go back to what they were doing. Even more unnerving was that often our clinicians were the last people that patients saw and held their hands while they took their last breaths. It was very difficult. One of the major responsibilities of the Health and Research Foundation is to look after the well-being of our clinicians, offer support for their emotional state, as PPE does for their physical protection. We started by sharing resources that Lisa has shared with you already, and that are available through Vibrant, through the city, through the state, and then online talk therapy lines, et cetera. However, we weren't sure how many people were taking advantage because we know that clinicians are less likely to seek services. Stoicism and stigma make it that much more difficult for them. They feel like they should be, handling it okay. So we needed a multi-level approach to meet people where they were, protecting their confidentiality, and making it safe to participate in as little or as much as they needed. So we're very lucky that New York State Health Foundation understood the need to approach it this way and help support our multifaceted emotional support program for frontline workers. So with safety as the utmost concern, we offered a number of webinars addressing resilience, stress management, mindfulness, balancing work and family during COVID. We also heard from a lot of clinicians that much of the support that was most helpful to them was through their colleagues working beside them, asking, hey, how are you holding up? Because we understood the power of that, we asked Vibrant to do a number of the trainings Lisa mentioned that enhanced their abilities to really help each other. So those were psychological first aid training that she mentioned, the staying in balance training that is also part of that booklet, that the link she sent you. We did vicarious trauma training because people don't think about if they're being traumatized vicariously. It's hard to recognize it in yourself. And sometimes you see it in others, but you don't know how to approach it. And on top of that, we did an additional training for supervisors to see if they could identify vicarious trauma in their staffs so that they could reach out and offer some kind of support. We also had support groups for physicians. We knew physicians are very shy to talk to anybody, and so we made sure that our support groups were run by a physician so that they felt like she knew where they were coming from and what they were going through. We also knew that people needed to feel safe to ask for individualized help. I mean, all this other help is great, self-care, you can kind of do it anonymously, and you know, it works for a lot of people. But we knew that some people needed individualized help and that clinicians were just less likely to be proactive about this. So we developed our How Are You program with Vibrant, in which we proactively invited everyone to participate, every 4,000 staff now, to receive 15 to 45 minutes of time with a Vibrant crisis counselor to really check in and offer a follow-up plan if needed. And it was, you know, we made sure that we weren't singling anyone out, but that everyone got this opportunity to speak to someone without judgment. So now I'd like to share some reactions and feedback we received through our journey. Next. Thank you. Thank you for doing my slide. So we heard some very interesting issues and you know, reasons for anxiety. We heard that grief about the death of their coworkers. It was really hard that when coworkers died to come back to work. There were some people who were not allowed to work because they have higher risk for COVID. So they felt really bad about that. A lot of people felt very angry that they were seeing people on the streets with no masks while they were struggling inside to save people's lives. And they felt they were very torn between being at the hospital for 18 hours and then going home, and the kids weren't in school, and it was very, very hard on them. And that gave them less time to even think about themselves. So they weren't exercising, they weren't eating right, and they you know, could barely get these you know, their lives together day to day. They also had a very interesting thing. It was you know how people called them heroes. This is an additional one that's not on the slide. They don't like that. They feel like, this is my job. And if I'm such a hero, why aren't you helping me with PPE? Why aren't you getting the tools I need? So that was a source of anxiety, you know. But we did get great feedback. After speaking with you, I feel a level of calm that I haven't had in months, one participant said. Another one said, I got information, techniques, and peace of mind sensation. And then one thanked us for bringing in family programming. This isn't easy on them either. Assuming it's a child. We did like a child night with the whole family reading a child's book about grief. So I'll just wrap up by saying what we learned were some very important lessons. People are at different levels of need, from self-care to individual therapy, and one size does not fit all. Time to engage in these activities was one of the biggest barriers for them to participate. We heard that over and over. Oh, I wanted to be at everyone, but I can't take that kind of time. It's just too busy. And then the power of collegial support, whether in workshops, as Lisa said, or on-site training, work cannot be underestimated. This brings a world of possibilities at any budget. Thank you so much for giving me the time to share our experience.
Great. Thanks so much, Tahina and Lisa. We really appreciate it. So I'd encourage anyone in the audience to feel free to chat any questions that you might have in the chat box. We have some time for discussion, and I'll kick us off. But then I'll also be monitoring the chat box if there's other questions that arise. So I thought, we could talk a little bit more about picking up on Tahina's just last point you made about, the scalability of interventions and how to operate these types of interventions when organizations might have limited resources, which we know most do. And so, even what are some of the successes you see when you have a short training, or if you're able to do one time or multiple activities? What are some of the benefits, even with limited resources, that you've seen and achieved?
Well, I think the webinar series is very good because they can do it from anywhere. And once you've paid for a speaker, we could have had 4,000 people on it. So that's quite scalable. I also think that programs that that colleagues can do with each other can really make a difference and not cost any money. I'll give an example. We had one doctor in the ER who made all his colleagues write their 6-word story about why they chose medicine. And it became this thing, like everybody did it and everybody talked about it. And then another hospital called and said, can you help us do this project? And then he put it all together and it's online and people loved it. He said it was a really amazing way for them to connect with each other during the crisis. So there's like some free things that you can do. So I'll stop there and let Lisa chime in.
Yeah, I mean, I think one of the challenges around time, I mean, what I always tell folks is what's already pre-existing time. Is it a weekly staff meeting, a monthly staff meeting, any kind of gathering that you're having with your folks? Even giving them, for example, the self-care assessment and saying, hey, this is for you. We're going to take 10 minutes and everybody's going to fill it out. We're not necessarily going to share results, but we're carving out that time for you to take a look. Using pre-existing time is helpful. Having a list of resources ready. Really talking about it a lot. It's not enough to just push out resources because uptake can be low. And people need to hear things typically more than once before they think, oh, this is for me. This is something I can do. So pushing out resources, but then engaging people around it. Hey, did you get that email that had these numbers in it? Did you hear that we did this webinar? Here's the recording. The other thing I would say is, nobody has to reinvent the wheel. And it is really helpful, for one thing, to engage staff on what do you need? I can't think of everything all on my own, nor should I. So I would want to hear from people, what would be best? Is it 10 minutes at the top of every staff meeting to meditate? Is it a larger organizational wide intervention that we need to do? So talking at all levels about what helps and what is needed can really go a long way. So don't feel like you have to start it all on your own, by yourself. Engage your people in it, and there will be more buy-in also.
That's great, thanks. And kind of picking up on that, we have a good question from one of the audience members is, how do you start that discussion with staff? I think some people have concerns around asking questions that then might yield answers that they don't feel equipped to handle as supervisors or as an organization. I'm curious a little bit about how that maybe you've addressed that in your work or through your trainings.
Well, I mean, I think we do have a program in the hospitals where it's called Healers Helping Healers. And so one of the most important principles of that is really checking in with people and just saying, how are you doing? Like really, not just how are you, but how are you doing? And even Governor Cuomo had started, How Are You Really campaign to, ask the question, then really listen. And you'd be surprised how many people will open up or just feel so supported that somebody asked them how they are really doing. So that was one thing. The other thing is we didn't really just kind of make people say that they needed help. We kind of offered it and then people opted in. So that was a really good way to make people feel very comfortable to participate.
That's great, thanks. And Lisa, do you have anything to add maybe there about kind of making those referrals when there might be something outside of the scope of a supervisor?
Yeah, I mean, certainly talking individually rather than in groups about what's going on, and kind of normalizing it as part of the culture that help seeking is actually part of not only taking care of yourself, but ultimately doing your job well. And certainly saying, is there anyone that you have to talk to? What are the resources that you're using? Here's information that people have been saying is helpful. So it's not about ever going back and asking, hey, did you ever get into therapy? But broaching the idea that getting more is actually a sign of strength. Getting more is a way in which the organization supports people doing that. So there is a culture shift that has to happen. And it really is, should material come up that really seems like it is more personal or clinical in nature, there can be a thoughtful redirect. That does sound really, really difficult. I can hear that. I'm wondering if you need extra resources to deal with that. Let's talk about what can be done here at work. Let's talk about what might be helpful outside of work, so that you're not delving into the actual issues, but you're saying, here's how to manage them in a way that can be helpful.
Great. No, that's really helpful. And I think, follow-up question that just came in, which I think is an important one, as I kind of alluded to at the beginning, is, based on the work that you've done over this past 6 to 7 months and what I guess would have been, the first and second wave, and now that we're entering into this new period where people have already kind of lived through the initial phase, what do you think is going to be different with this next phase? What, where might there need to be more resources? Are you seeing things now in terms of people's almost, being really tapped out in terms of how much they've put in over the past 6 to 7 months? So curious how you're thinking about that, even as you've been doing your trainings and preparing for the fall and winter.
Well, I think for us, as things get a little crazier, I'm hearing of different problems people are having. Like people are asking me, like, my children are regressing. What can we do? They want their old mommy back. They want school, their friends, and they're acting out. So, how can we? So I'm thinking, I keep listening to people as these needs evolve and things change in the environment. So I would like to continue to have and support groups and just be thinking about new things coming up.
Great. And Lisa, do you have any kind of closing piece on that as we look to the winter, as we're kind of coming on time?
The only remotest silver lining in this is that we've been doing it. And so when this first hit, none of us knew what to do or what to expect. People do have resilience. They are activating it all the time. People have put things into place. It's really a time to learn from that, what has worked. So not just what is upcoming that we're going to need to deal with, but what has been helpful, what do we know works, and how do we beef that up or continue to apply it? So taking that strengths-based perspective is also really important, especially because we've all had experience now.
Absolutely. Thank you. No, I think that's a good point to land on. Half an hour always goes by very quickly with this series. But I really, really appreciate both of your time and your thoughts. And to everyone who's listening in, we are, as I said at the beginning, we'll be sharing around the resources. And as part of those resources, we'll also be sharing Lisa and Tahina's information. One of the things we really wanted to get out of this session is some sharing across. So if there's best practices that you all have found on your teams, we'd love to hear about those. And we can make sure to share those on the event recap page as well. So thanks to everyone for joining us. And wishing you all good health. Thanks so much.
Thank you.
Thanks, everybody.
Bye-bye.